Screening Tools for Pediatric Anxiety by Ayesha Dholakia, Brenna Chase, and Katelin Blackburn. In order to facilitate your history taking and diagnosis, you can use one of several validated screening tools. Keep in mind that parents and children may differ in their report of symptoms for a variety of reasons, including that children may underestimate their symptoms to give a more desirable response, and parents may not fully know about the symptoms their child is experiencing. For this reason, it is sometimes appropriate to give the screening forms to both child and parent depending on this child's age and developmental stage. One instrument is the SCARED screen, known as the Screen for Child Anxiety-Related Emotional Disorders. This comprehensive tool is a child and parent self-report instrument used to screen for several different anxiety disorders. It usually takes about 10 minutes to use and is intended for use in children age 8 to 18 years. Instructions for scoring the SCARED are straightforward and typically found on the last page of the document. A total score of greater than or equal to 25 may indicate the presence of an anxiety disorder, with scores higher than 30 being more specific. High scores on certain groupings of questions may also indicate a specific anxiety disorder. The Pediatric Symptom Checklist, or PSC-17, is another screening tool providers should be familiar with. It is a general mental health screening tool used typically in primary care practices and asks questions about internalizing symptoms, externalizing symptoms, and problems with attention. Though not specific for anxiety disorders, positive internalizing scores are concerning for anxiety and other mood disorders. This screening tool is designed to be used from ages 4 to 15, with adolescents 11 and up completing the YPSC themselves. It is also important to keep in mind that children who suffer from anxiety disorder are at a higher risk for comorbidities, including depression and ADHD, and it is important to screen for these disorders as well. For more information about screening for these other disorders, please reference the other videos in this series. Lastly, you may have heard of the Gad7, which is another well-researched scale but is only validated for children's age 13 and older. Scores on the Gad of 0 to 4 suggest minimal anxiety, 5 to 9 suggest mild anxiety, 10 to 14 suggest moderate anxiety, and a score greater than 15 suggests severe anxiety.